sports. Now, CalBank has presented PPEs worth 230,000 cedis to the University of Ghana Medical Center. Chief Risk Officer of CalBank, Barbara Banson, says the gesture is a joint initiative by staff and management of the bank to contribute 10% of their monthly salaries to procure PPEs for the hospital and support their work. There is more in this report.
The items presented include safety goggles, face masks, bleaching agents and face shields. The Tamale Teaching Hospital, Ifeanyi Hospital, Komfanoti Teaching Hospital and the Ghana Medical Center were also beneficiaries of the donation. Chief Risk Officer at CalBank, Barbara Banson, said the initiative was to continuously keep frontline health workers armed with the necessary resources to control the spread of the virus.
Our motive is to contribute in a small way the fight against the COVID-19 pandemic. We heard the call from government for citizenry to help in, procuring PPEs for our frontliners, the health service staff. So, being the responsible citizens of this country, the board, the staff of CalBank came together to contribute from our salaries. We gave a range that we gave between 10% to 25% of the monthly salaries of our staff. Some contributed more than what we were asking for, which we are very grateful to our staff. And then whatever we got the board members to top it up to make it even, for us to get the 230,000 Ghana cedis to procure the PPEs for the hospitals.
Regardless of the easing of restrictions on social gatherings, Barbara Banson said the bank would continue to strictly enforce the protocols and directives outlined by government.
I'm urging everybody, every Ghanaian, everybody in this country to continue to comply with the health, the hygiene protocols that have been put in place. For CalBank, we have our own, COVID response team, where we've put in most of these protocols. We have people in the strategic places in the organization, the branch, the head office, to ensure that every staff, before you come into the building, your temperature is checked, you have the facial masks on, and then the social distancing. Because of that, we have to get people to stay at home and work from home. And then when it comes to the customers' side of it, before a customer comes into our branch or even our head office, they need to wash their hands first, and then we apply the hand sanitizer. We check the temperature before we are allowed to do business with you.
CEO of the University of Ghana Medical Center, Dr. Darius Osei, said the facility has so far had over 100 cases with an impressive recovery rate of over 90%. He, however, expressed concerns over people's reluctance to visit the hospital out of fear of contracting the virus.
We want to thank all members of staff and of CalBank for this great gesture, because these are all disposables, and it means once you use them, you need to dispose of the items. Presently, today we have 23 patients in the normal ward and then 4 in the ICU. But this is a continuous process. As patients come in, we treat them, they are tested negative, and then within 24 hours another negative. They move out and then others come on board. So every day you are having a turnover of some numbers. But the recovery, I can say, is over 95% so far. COVID is one condition of health menace, but we also have hypertensives, we have diabetes and others. I think we must brace ourselves and then prepare ourselves towards meeting all these needs, including COVID patients. We are asking the general public that now we are open. There are a lot of services that are available. I mean, anybody who wants to use the facility must not be scared that we've been designated for COVID, because we have played safe since we were nominated to take care for COVID patients.
Agape Queen's report for JoyNews.